this has been an extraordinary opportunity, and I really want to congratulate Gates and 3IE for their vision, and for one of the very rare occasions where you've had 4 different teams of behavioral scientists working on the same challenge. And as a behavioral scientist myself, this has been an extraordinarily rich opportunity to reflect on different approaches, different sets of learnings, and what the big lessons are for the field of behavior change as a whole, because obviously what we're trying to do is change one. Who knew how complicated it was going to be to change toilet use behavior? You would have thought that was so simple, yet it's turned out to be an extraordinarily complex challenge. It turns out that almost every behavior that we try to change is a complex challenge. And so I'm going to try and pull together the lessons from the whole group from the perspective of behavioral science. But also, I think there are lessons. So there are lessons for toilet use, but there's also some much broader lessons about behavior change as a whole. And many of us will not just be working on the problem of toilets, but many other public health and public policy problems. So it's been a fantastic opportunity. I think a little bit of history, I think we can say that behavioral science has come a long way. So 20 years ago, when Prabhakar and I were first working together in Lucknow, I think we were thinking about how to change the world. We had big ambitions. We wanted to design interventions that were going to get everybody behaving hygienically in Lucknow. I think we failed, but I think what we started there was quite exciting. It was a realization that it wasn't about education, that everybody really already knew that it was healthy to use a toilet, it was healthy to wash their hands with soap. It was about something else, and the question was, what was that something else in the middle? And I think that was where we first started to fill in that gap on this problem. Many others, of course, have tried to fill in that gap in many different ways. So it used to be thought that all you needed to do was educate people and the world would change. But we've learned there's a lot more going on in the middle. We need to change the world so that people will change their minds and change their mindsets, so that they will change their behavior, so that we can improve diarrheal disease, for example, or dignity in the world. And we need to do that in the environment in which these people are living and behaving, the behavioral setting. And the behavioral setting is like treacle. It forces people to behave in certain fixed ways. Getting them to change is incredibly difficult. If I asked one of you to stand on a chair and sing a song, you wouldn't do it, right? Would you? Any volunteers? Okay, never mind, I'm not going to make you do it, but normally it takes 5 minutes for someone to volunteer, because we are in a behavioral setting where there are rules about how you behave, and there are chairs which are not for standing on, and there are objectives that we're all trying to achieve, which is to have a conversation with each other. So if somebody stood on the chair and sang a song, we would throw them out because they would be getting in the way of us achieving our objectives. So we are stuck with a really, really sticky problem. People's everyday routine lives, the way they behave is fixed, and disrupting that is very difficult. So that's been the problem that behavioral science has been trying to and I don't think behavioral science has fully cracked it. As you've seen from the changes that we saw, were fairly small, if at all, in the programs that we designed, with all our clever behavioral science. I think there's 2 basic fundamental points that come out of all 4, which is it's about brain and about behavior. It's about brain and about environment, changing environments such that brains change. Probably our most sophisticated approach to behavioral science of the 4 was the work done by the AWAG team in Karnataka. I was going to say Karnataka, yeah. To actually start measuring what the behavioral determinants were, and then look at how those behavioral determinants actually affected latrine use behavior. And I think you can see there that one of the biggest things was others' behavior, which is, if you like, the norms. What I'm talking about here, it is not a norm to stand on a chair and sing a song. It's very powerful. How do you change that norm? You tell everybody that this is a wedding, and everybody has to stand. It's a tradition. Everybody has to stand on a chair and sing a song. Maybe you could get people to do it. So disrupting norms is really, really important. And that helping people to walk through that daily routine and find new ways of behaving was incredibly important for that group. For other groups, it was the collective. In Emory, people wanting to do what was good for the village, and learning skills. For a PM, it was habit, really important, as we talked about, but also anxiety and misinformation about pit filling. For our team in Gujarat, the biggest drivers seemed to us to be that it was and I think that you find this in many different countries we've worked in. The world is changing dramatically. People are building paka houses. People are living. People have mobile phones and transport and communications technologies. But the toilet has been left behind. It's the forgotten thing. It's the one thing that we don't want to talk about. And so in Gujarat, we put our emphasis on modernity. You don't want to be left behind. You want to be part of the modern world. And that was where the 5-star toilet idea came from. But more than that, all the teams realized that it was about the technology. It was about the toilet. If the toilet wasn't working, nobody's going to. But I mean, most basically, I think we've learned that the most important behavior change technique, if you want people to use a toilet, is to build them a toilet, is to get a toilet, because you can't do it without that. And you've seen the big changes that have taken place across India in toilet use, which have largely tracked toilet building behavior. So that's number one. Number two, what more can we do to make that toilet loved, owned, used, and physically possible to use? And things like making it more convenient and making water available. All the teams, I think, found that was really important. So the first big lesson is brain plus environment. Other things that we discussed was the need for a process. Of course, we're all scientists and we want to. So who said they didn't want, who was working for an NGO doesn't want to be out of a job? Well, we don't want to be out of a job either. So we like to make things a bit complicated. We like to have lots of process to make things work properly. So this is an example of the process that we used, which is called behavior-centered design. And there's this very simple ABCDE process, where you assess everything you know about that behavioral problem. You then go and discover more by going to do formative research in the field. Then you bring a creative team to that problem. You set them a problem, which is how do you get people to, here's what we've learned about the drivers of use, and you get them to create a surprising, exciting, innovative campaign that gets attention, and so people notice it. You deliver that. Now there's huge problems with in delivery, which we've discussed a lot as well. And then you evaluate it, and then those evaluation lessons feed back into a new cycle of us all doing this better. So next time we'll be doing this. Next time we should be doing this better. So we all use in behavioral science. We all use some relation of that process, A, B, C, D, E. Something similar to that. It's a design process way of thinking. So we've clearly moved from the old model of IEC, social marketing, SBC. We're moving more into a world of nudge and behavioral economics, of more sophisticated psychology, where we're beginning to understand the drivers. We do have challenges with that, in that we have problems measuring those behavioral drivers. That's probably a problem for the scientists rather than for the implementers, but that I think we can discuss. So what are the big challenges we're left with from the behavioral science perspective? So all of us sitting in the room, we said, well, if only we'd had more time. Why couldn't we have had longer to design better interventions? They would have worked better if we'd had more time to do it again and iterate it. But when I discussed this with the secretary many moons ago, he said, we need your answers tomorrow. We're not interested in your answers 3 years down the line. Well, it's 3 years down the line, guys, and it's practically over. So somewhere we've got a mismatch here between having to come up with systems to design smart systems who can rapidly design sophisticated behavior change interventions, and the timeline, but we're doing science. Of course, science takes time. We need time to do the science. But somewhere we need tools for rapid, high-quality behavior change design programs. We need better systems for bringing in creative talent. Our approach learns from industry and uses industry creatives. But as we heard this morning, hiring private sector by government is extraordinarily difficult. At the beginning of Swachh Bharat, we tried to hire a private sector organization to set up a mass media campaign. And 4 years down the line, it's only just been contracted. It takes the government not 6 months, but 4 years to actually hire creative agencies. So how do we crack that one? Delivery has been a massive problem. It is the elephant in the room for all of our development programs. A country of nearly 1 billion people, how do you get an effective behavior change communication to them in a way, and how can you do it through a government system, which is the one that's doing the work? Let's debate that rather than me put any suggestions up there, but we haven't cracked that one. Another thing that was a clear theme is that we're in a world now where it's only a minority of people who are defecating in the open. They're the stubborn last mile. Why are we talking to everybody about it? Can we not segment what we do? Would that not be much more cost effective? And if so, how do we do that? For evaluation, I said the challenge remains of measuring mindsets, of measuring behavioural outcomes. That's been brought up again and again. If we're going to ask people to deliver behaviour change campaigns and we can't measure whether they do it or not, how can we pay them? How can we contract them? How can we find better measures of behavioural outcomes? When should we measure behavioural outcomes? These were done between 2 and 4 months after interventions, but maybe the time scale was wrong. Maybe we should have done it more sooner or later. And what we all did was complex interventions. We threw the kitchen sink at it. We threw everything we could. But it's very hard to say which of those elements of those actually work best. I think we're all pulling out some of our recommendations about what we thought was best. But even really good process evaluations, it's very, very hard to pick out one element or another that was successful. One of the ones that I think has come to us now, I think we've all agreed that one of the issues about toilets and actually about many behavior change programs is ownership. If there's a lot of evidence now that if you own a device, if you feel you own it, you're much more likely to use it. And I think the same is true of toilets. And it might be that we could all agree that we would like to try to distill the best of these interventions and test one hypothesis: does ownership improve use? As another trial to see whether that is a key factor. But again, we could debate whether those are. And then I just put a cross there to remind me to say that really what we all want to do is to be redundant so that we've got complex systems. Behavioural scientists can go home and do something else, and we can leave the government to manage programs and get behaviour change without needing a long process of behavioural science. That would be nice one day.
Thank you, Val.
Thanks.